Blazing Hot 91, the Blazing Hot Morning Show. Every single Wednesday, we take a pause to talk to, someone in Hampton Roads or someone that impacts you with health, healing, and Hampton Roads. And today, I am pleased to be talking with Councilwoman Angelia Graves. Good morning to you.
Good morning.
Good morning and welcome to the Blazing Hot Morning Show and welcome to Health Healing and Hampton Roads. Now, we're talking about the Census 2020 and how it's affecting and how pretty much the census is going to be handled here in the Norfolk area. Let's talk about the census.
Absolutely. So thank you so much for having me. I really appreciate the opportunity to come on to your show and to talk about such an important topic as the 2020 census.
Yes, indeed. Let's talk about making sure that people are getting registered with the census.
Absolutely. So there is a committee called the Norfolk 2020 Census Complete Count Committee, and I co-chair that committee along with my colleague on council, Councilman Tommy Smeagol. That committee is composed of a lot of, we've got city staff for support, but we also have voices in our community that are tasked with making sure that we get the word out, anywhere from folks in our local civic leagues and civic organizations to pastors and church members to those who are in our Greek fraternities and sororities, those who work with our vulnerable populations, with young children, and with our homeless. So we have a blanket approach, but a complete approach, as the name implies, the Complete Count Committee for the 2020 census. And so ideally what the census basically is, it's a population count. And if you know anything about money and how funds in Washington are distributed, and even funds at the state level, they are distributed based on population. So that word, if you see like per capita, it's a really fancy word that simply means per person, right? So per household in some instances, but per person in this instance. And so the Constitution requires that we carry out the census every 10 years. Now, this year is a little different because we are in the middle of a pandemic. We are all geared up. We were having our meetings. We were getting all of our paraphernalia with Census 2020 to be able to spread all over the city and to be able to do special events and things like that. And then COVID-19 hit. Corona hit us. And so now we are working pretty much virtually and on platforms like your radio program to get the word out to people about filling out their census form.
Yeah, indeed. Let me just ask this question in reference to it. When you're looking at the city of Norfolk, when you start to look at when the census population actually is counted, what does that mean for the actual city itself?
Well, what it means for the city of Norfolk is about $2,000, a little more than $2,000. It's $2,020 to be exact, per person that the city receives for funding of programs such as Head Start, WIC, funding to Norfolk Public Schools. And so if you look at like the 2010 census, we were undercounted by about 16 in general. The United States was undercounted by about 16 million people, but Black residents were undercounted by about 2.7%, and 1.5% of the Hispanic population was also undercounted. And so that is a big deal when it comes to money for schools, which we desperately need, when it comes to money for before and after care for parents who may need that additional assistance when they have to go to work, if they're providing for for their family. And so we want to make sure that we are getting the funding that the city is deserving of, because we have the numbers of households and the numbers of people, individuals, that are represented. The other thing that it also does is in the United States House of Representatives, it determines how many representatives you have. It can also determine how many Senate seats a state has and how those are divided based on locality. In the General Assembly as well, it can determine, how many delegates in the House of Representatives, as well as the number of Senate seats. And so that's why the census count is very important, and that's why we need people to participate.
If I'm correct, the date of the census has pretty much changed because of COVID-19. And a matter of fact, I do believe that the actual date has shifted a little bit closer towards the end of this month.
That is correct. So like as of August, only 1 out of 10 households have been counted. And so we have less than a month to reach our hardest population to count. And our hardest populations are those individuals who are homeless, those individuals who English is not their first language, those individuals who are transient, our college students. Also, the little people, they tend to just get forgotten. If they're under 5 years old and they're maybe not in school, parents love them, but they tend to forget them. And so somebody would say, well, why is that important? Well, if you have a child that is a 5-year-old now, over the course of the next 10 years, you're going to be looking at, based on the census data, what do we need for junior high schools? What do we need for high schools? What do we need for teachers? What do we need for, all of the things that are going to contribute to the well-being of and the community of that child? How many recreation centers are we looking at that we may need based on the number of children? And so we want to make sure that we count everybody, because that 5-year-old in 10 years, when we do this again, is going to be a 15-year-old. And so we want to be able to accurately get funding, apply for grants, do the things that governments are responsible for, which is taking care of the public. We want to make sure that we're doing those things. But in order for the money to be available, we have to have the count in order for us to be able to know how to accurately forecast what our needs are going to be as a locality.
Now, you mentioned the homeless. How can the homeless be counted if they're homeless?
Well, that's a very good question. One of the ways that we do that is working through our Community Services Board. We also work with our local homeless shelters, so that and those other community type of programs that deal directly with the homeless population. And so there are people who have volunteered to go into those homeless shelters and go to like feeding events and things of that nature to be able to get the information that is necessary, because there's funding that comes from the federal and state government to help support the homeless population. And if we undercount them, then we won't have the funding to be able to support their needs.
And the same thing, I guess, for the college students that are in dormitories?
Yes, we work directly with not only the college students, but the military as well. We work directly with the colleges and universities. A lot of them have offices for campus life. And so we work directly with the colleges and universities to be able to get accurate counts based on their student body, and based on who's there in the dorms and when they're there. We also do the same thing with the military. They kind of do their own count, and then they provide that information directly to the Census Bureau, who's stationed where on April 1st. And so that's where, because here and again, allocation of funds. If we know we've got a certain number of people stationed in Norfolk Naval Base or stationed at the Coast Guard, then we want to be able to accurately account for that, even though those numbers may change. But over the course of 10 years, you look at what new individuals may enroll or enlist, rather, into the military and where they have the option to be. We want to be able to properly provide support that is needed for the military as well as for our college campuses. And here's the other thing, like, we need to know, like, we look at the 10-year basis, the last 10 years, we're looking at this 10 years. We need to know that in 10 more years what to expect, or over the course of the next 10 years, what to expect with regard to college enrollment, so that cities can work hand in hand with the colleges and universities to be able to provide the proper support.
You're listening to Health Healing in Hampton Roads. We're speaking with Councilwoman Angelia Graves, co-chair of the City of Norfolk's 2020 Census Complete Count Committee. I hope I said that correctly all the way.
You did. You got it right. It's a mouthful.
Yes. Let's talk about COVID-19 and how COVID-19 has affected everything that is going on.
It's like, what hasn't it affected? It really is. It has changed our way of life, in a manner of speaking. It has also made us more cautious when we're dealing with individuals. And what it has done from a census perspective is it has made it more difficult for, normally during this time, we would have folks out, I want to say after the middle of September, we would have folks out going door to door, knocking on doors, helping people fill out their census forms. These would be official census workers. They'd be helping people fill out their census forms. And so they're not really able to do that with regard to helping folks fill out the census form. What they are able to do is leave little reminders on your door about filling out your census form and your case number to be able to do that. And, before we talk about COVID-19, I do want to say one more thing about the census, in that there are 3 ways that individuals can return their census. And there's 2020census.gov, and that's 2020census.gov. You can go online and you can fill out your form that way. You can call in your information at 1-844-330-2020. That's 1-844-330-2020, and choose your preferred language and take the census. Or you can mail in your census form if you have not done so already. So there are 3 options for you to be able to turn in your census information. As far as COVID is concerned, we are still, encouraging people strongly to wear their mask, to remain social distance, or to abide by social distancing guidelines, and to make sure that they're washing their hands or that they're using hand sanitizer, and that they're just being careful and that they're just being safe so that COVID ends with us.
Also, with the City of Norfolk, how is it affecting the school systems right now?
Well, our school board elected that they would start the first 9 weeks, if I'm not mistaken, of school in virtual form. And so we want to make sure that parents know, if they're new to the area, make sure you find out early what school your child is going to. Get your child registered, because you still have to do that. And then make sure that you are staying in touch with the school as well as with the staff in order to know what is being required of your child from a virtual standpoint. If there are any packets that you may be able to pick up, because we all know that every student is not necessarily a virtual learner. So are there paper packets that you can pick up, or is there something you can download and print to get the information that you need to be able to help your child? And then stay in touch with your school to find out what types of free resources there are available for tutoring and help for your student, because I know I'm not a parent, but I can guarantee you that if I was a parent, I didn't sign up to be a teacher. So, not of educational stuff. I signed up to teach them good manners and to be good people, but I did not sign up to be a math or science or, English teacher. So there are lots of resources out there for parents, and teachers are going above and beyond to stay in touch and make sure that parents have the resources that they need in order to help the students to get everything that they are supposed to in order for kids to stay on grade level.
Thank you so much for joining us on today's Health Healing in Hampton Roads. Councilwoman Angelia Graves, thank you so much for coming on the show.
Thank you for having me. I really appreciate the opportunity.
It's Blazing Hot 91. We'll get through this together.